group at the Internet Society for helping us do the live broadcast. So we do always broadcast on YouTube as well, every event that we do. So if you have never been to an Accessibility New York City meetup, you never have to attend in person. You can always use the YouTube stream. And today we'll be monitoring the YouTube stream and this Zoom environment to make sure that we're including people's questions or comments as the presentation goes. We also want to acknowledge Mira by Night from White Coat Captioning. Is providing the captions for today's presentation and discussion. So every event that we do, we have closed captioning and we have open captioning on the YouTube stream so that people that join live can experience the captions as the event goes on. We want to acknowledge our sponsors, Adobe and Level Access and Equal Entry for being able to host these events. And for those of you that have been to one of our events, we typically do meet at the Adobe office now in New York City. But until this situation changes, we'll be learning and working in this Zoom environment. So as I said at the start, if you do have any feedback about how we can improve the accessibility of this experience, please share it with us. Before we kick off, if you type your questions into the chat, we'll be monitoring that through today's presentation, but we will be asking those questions at the end of the presentation. And if you prefer, we'd be happy for you to turn your video on if you want, or turn your mic on if you want at the end of the presentation, and you can ask your question directly to our presenters today. So with that, we're very excited to have Walei Sabry and John Novick from the New York City Mayor's Office for People with Disabilities. We want to talk about the COVID-19 response and have a discussion. And so we're happy to have them, and take it away, guys.
Thank you, Thomas.
Thank you.
So let's start with an access check. This is something we do in the disability community. We encourage you guys to work it into your events. So we do have captions, and hopefully they're working all right. Let us know in the chat if they're not. What was the other thing, John?
Well, in terms of the captions, this is Jonathan Novick speaking.
Yeah.
For those of you who are joining us via Zoom, I'm unsure if there was a call in as well, but you should have the option, whether you're on your phone or your computer, to turn them on. There should be a closed caption option. Depending on the size of your screen, you might need to select the dot icon indicating more. It should be labeled as more. And then you can turn on the captions, turn them off. You could also view a full transcript if you want additional context. Or want to select, you want to see more than just the individual line by line.
Just let us know in the chat. So I am coming at you guys from my living room apartment, which I'm very happy to be here right now, because 20 minutes ago I was locked out of my apartment, sitting on my couch currently, and I am a Middle Eastern male with dark brown hair, and I'm wearing a green polo, and I identify as a blind person.
And my name is Jonathan Novick. I'm also happy to be coming to you live from my bedroom. I did not have a similar experience to Walei, but I'm here. I am a Caucasian little person, and I am wearing a blue and black checkered shirt. All right.
All right, and we usually, we're doing this in lieu because we're not really using any visual aids today, but we encourage you guys, if you ever use slides or anything like that, to read the slide titles and describe the images in your slides. I heard a message, somebody's having a black screen, they're not seeing the video.
Yeah, somebody asked, is there supposed to be video? I only see a black screen. Wale and I both have our video turned on, but as Wale mentioned, we will not be sharing any specific relevant visuals as far as, uh, a way of troubleshooting that. If you do want to see us and other speakers who will be sharing their video, you should be able to, it might be in your display settings. Uh, Sean just messaged, I can see the video, but as an alternative, maybe try the YouTube live stream. It should be in your view preferences, perhaps. If you go open to view, um, show manage participants, there could be some options as well on the top of the screen that say things like speaker view, things like that. And this person just messaged in the chat, works in YouTube, so I think we're good. Okay, great. So with that access check being said, Wale, anything else you want to add before we get started?
No, let's go. Let's get it going.
Okay, great. So my name is Jonathan Novick, and I'm the outreach manager for the Mayor's Office for People with Disabilities. And basically, our office during what we call blue skies, which is when there's not an emergency situation, our main goal is to work to ensure that people with disabilities have equal access to everything New York City has to offer. This is transportation, housing, benefits, employment, and although right now we are in the middle of a pandemic of COVID-19 response and action, this mission does not change. And in everything that we have been doing, we are continuing to do everything we can to ensure that people with disabilities are included in communication, included in response, and included in resources. So today, what we're going to be discussing is all of these things from the beginning, precautions that we took working both internally and with our city agency and public partners to ensure that people with disabilities were included every step of the way, what we've been learning and what we continue to learn. And we will be alternating back and forth, speaking on the individual things that we've been working with in a sequential order of how we've been rolling them out. And as Thomas mentioned, if you do have questions, please for now either enter them in the chat or hold on to them, and we'll be having a question and answer session at the end. So as I mentioned, MOPD, we work to ensure equal access to everything New York City has to offer. And I'll say this again at the end, but if you are a person with a disability, or if you don't know how to get in contact with our office, you can call us anytime at, well, not anytime, 9 to 5 at 212-788-2830. That's 212-788-2830. We also have a video phone conferencing line called ASL Direct. It's a program where a person who is deaf can directly connect with our office to somebody who is fluent in ASL and receive resources and information in ASL. You can contact our video phone number at 646-396-5830. That's 646-396-5830. Or you can also visit nyc.gov/ASL as an American Sign Language. That's nyc.gov/ASL. And finally, we have our website full of resources, both for Blue Skies as well as for COVID response, which we're going to be talking about more in depth in a few minutes. And that is nyc.gov/disability. That's nyc.gov/disability. So COVID has been something that has been going on, I think, has really ramped up in the middle toward the beginning of March. And we have been having a lot of different conversations, as I mentioned, with the disability community, with individuals with disabilities, city agencies, etc. And the first thing that we wanted to do, or we wanted to make sure that was happening, is that all of the resources that were being shared, both by our office and City Hall and the mayor's office, were accessible for people with disabilities. And we did this in a few ways. First, press conferences. The mayor of New York City, Mayor de Blasio, has a daily press conference that he goes over every single day where he'll talk about the latest COVID updates and everything else. For these press conferences, we have made sure that they include both American Sign Language as well as captioning. When we first started, this is not new, at least for ASL. It's not new. Jonathan Lamberton, the captioner, fantastic human being that does a lot of really good work with the city in terms of interpreting, traditionally would just stand next to the mayor, whoever is speaking. But When social distancing, when those practices and protocols went into place, of course, he got smaller and smaller in the frame because the people were sitting 6 feet apart from each other, and then he would need to be standing 6 feet apart from them. So through a lot of work through emergency management and New York City media and Mayor's Office of Immigrant Affairs, they have provided a lot of work into putting a picture-in-picture model in place in New York City. So now Jonathan does not even need to be in the building or the other interpreters to include ASL. So that's something we're very happy with. The second is website and PDF accessibility for everything that Health is putting out and other agencies. And for that, I'm going to turn that over to Walei.
Yep, and somebody requested that we type the phone numbers in the chat. I already wrote the
Yep,
voice phone.
I will continue doing that.
Video?
Yep.
Okay, great. So hi again, guys. My name is Walei Sabry. You can call me Wally. I am the Digital Accessibility Coordinator for the City of New York. And I will wait for 1 second because I live in a New York City apartment and the train is right above me and it's passing by. So I don't know if it's too loud right now. Sorry about that, guys. So my job is to assist New York City agencies in making their digital content accessible. That's our websites, our social media, our electronic documents, apps, videos, and anything else digital. In this time during the epidemic, I've been working closely with agencies like the Department of Health, the Department of Information, Telecommunication, and Technology, the Mayor's Office, and Emergency Management, and other agencies that are involved in the response. Mainly, I've been making sure that information about COVID-19 is available in accessible form. So we have the nyc.gov/coronavirus page, which has been built as a website to inform New Yorkers about what's going on and how they can get assistance and what they should be doing. So we have been working with Department of Health on making that accessible since the beginning of March, and it has drastically improved since it first launched. Making sure that we have headings and alt text for images, and that the structure of the page is accessible and easy to follow. Also, tagging languages, that was a big thing because everything we have to do has to be in multiple languages, available in multiple languages. So that's something we sort of had to address early on. There's also a ton of PDFs on that website, which we have been, once again, guiding Department of Health and the vendors that create PDFs for them in ensuring that they have a process that is accessible, that creates accessible PDFs. And we've definitely come a long way since the first PDFs posted on that website. Once again, building in things like heading structures and proper heading tags, proper list tags, alt text for images, and making sure that the links work as well, and the reading order is the same for screen readers as it is visually. So where we're at now is we are working on the coronavirus data pages. They're using data visualizations, which are great for conveying information such as numbers about the epidemic and hospitals and cases and deaths and stuff like that. Unfortunately, they do pose a big issue for screen reader accessibility. So we're working with the developers to make sure that that is going to be accessible. We're currently rolling out a new set of pages that hopefully will be much more accessible than the ones that are there. We're using a data visualization called Data Wrapper, as well as one data visualization in Tableau. So we are kind of just trying to push the vendors as much as we can to ensure that the products that they create for us are accessible. And in terms of more recent stuff that has rolled out, we rolled out a map for distribution of face coverings. So the Parks Department has been distributing face coverings for New Yorkers that need them. And the map is using an accessible template that the Department of Information Technology and Telecommunication, GIS team has created, and I've worked with them over the last few years to make this template accessible. So the template is being used for this face coverings mask, and it provides text alternatives. So you can just using a screen reader or a keyboard, enter in an address and get a list of results of the nearest locations where you can pick up face coverings. Another thing that we've worked on is the COVID-19 engagement portal. That is, it contains the tracker for folks who want to identify themselves as having had symptoms or having had COVID, for the city to track numbers, as well as it includes the delivery service that the city is using for vulnerable populations to deliver food. So we early on, or at least I early on, when it first launched, identified some accessibility issues that were keeping folks that are keyboard users and screen reader users from being able to use that effectively, and reached out, and we were able to fix those issues. So that's sort of the work that we are doing in terms of digital accessibility and websites and PDFs. On the other hand, the city's also reaching out through social media. I've been working with, or not really working with, but staying on top of city agencies on Twitter, including the Mayor's Office, City of New York, Department of Health, Health and Hospitals, Emergency Management, New York City Parks, and folks like DOT, to make sure that they are making their posts accessible by including alt text for the images that they use. We've had a lot of success in getting them to do that, and a lot of the posts that they've been putting out there in the last month or so have included alt text.
Great. This is John Novick. Walei, thank you so much for that information on websites and social media. So that's what we've been doing, at least as a baseline in terms of communications. Press releases, websites and PDFs, resources and portals, and social media. So all of this conversation that's happening, whether it's coming from our office or our city partners, we've been doing everything we can to ensure that it's accessible for folks who are blind, low vision, deaf, hard of hearing, and other disabilities as well. Next is outreach. As we are, while it's great to say that this content is accessible, but is it inclusive of people with disabilities? Is it addressing the need of people with disabilities? So we've been doing a lot of outreach with the community as well. We have a few sets of meetings. So first is a weekly meeting with disability advocates. These are specifically the agencies that we work with regularly during these blue skies scenarios. This is independent living centers, disability specific organizations like Lighthouse Guild or Hearing Loss Association of America, as well as our private partners who do a lot of work with us in terms of employing people with disabilities through our NYC at Work employment program. So we have a check-in meeting every week where we share the latest information. We have folks on the line regularly from Department of Health and Mental Hygiene, Emergency Management, HRA, and other agencies, like guest agencies, based on what's going on. For example, last week we had on Friday somebody from the Department of Consumer and Worker Protection to talk a little bit about what's going on in terms of price gouging, where can you report it, as well as the COVID-19 economic impact payments and some finer points of what are the expectations, if your level of income exceeds such and such, how could you exceed, or I'm sorry, how could you, when would you expect to do this or receive the payment, or is there any additional action that you require? And then we take all that information and we also try and have an open discussion. After our updates, we listen to what's going on in the community, what resources are working, what resources are not working, or just individuals that say, I specifically need something, and then we try and connect with them offline to provide them with the support that they need. next reoccurring meeting that we have is with our disability service facilitators. So for those of you who are not aware, as a result of a local law that was passed in 2016, every city agency is required to have what is known as a disability service facilitator. This is a point of contact within a city agency to both be community facing for questions and concerns, as well as to work with us to understand best practices in terms of accessibility and work to ensure that their agency is within compliance. Now, if you're interested in learning more about disability service facilitators, you can visit the Disability Service Facilitator website, nyc.gov/DSF. That's nyc.gov/DSF, as in Disability Service Facilitator, which will talk more about the law, as well as provide a full set of contact information for each individual city agency. So let's say you have a question for a disability specific question or concern for human rights or HRA or emergency management or other city agencies that I mentioned, there is a DSF for that. Now, with that background, we're also checking in weekly with our disability service facilitators as well to talk about what we're doing and what we're seeing, what the issues are, and to understand what's coming down the pipeline for them. What are the programs they're working with, and what are concerns do they have for people with disabilities, and how can we work to address those? And then finally, more specifically, we recently on Thursday, on April 30th, we held our first, but not our last, Deaf Town Hall, which was a learning experience. The idea was to hold a 1 hour, to take in questions from the community and try and address as many as possible. We provided some updates of information on what the city was working on. And we had ASL and captioning. Unfortunately, we ran into a technical glitch, which was that we started in Zoom, just like we are now, and we basically exported the live Zoom into Facebook Live, and unfortunately discovered that the captioning was very difficult to read, was delayed, and it was at no fault of our captioner. It was because of the technical glitches. So that's something that we're going to be working on to try and perfect, so we can continue to have conversations within the deaf and hard of hearing community. So something we recognize and we're going to learn from and move forward. But with all of these touch points, working with people with disabilities, working with our disability service facilitators, working with folks who are deaf, hard of hearing, and everything that we're hearing, we wanted to put together a location, a place that we can share disability specific information. And that is our coronavirus website, specifically for people with disabilities. I shared the link earlier. I see a lot happening in the chat. Walei, if you could share it. Type out the link. It's nyc.gov/disability-coronavirus. That's nyc.gov/disability-coronavirus. And that has information and resources based off of the needs that we were hearing within the disability community. So right up top, we have food and supplies delivery and pickup for people with disabilities who are unable to leave their home, who are concerned about their immune systems being compromised for one reason or another. Maybe they're okay with leaving their home, but are concerned about going into stores. So we have information like various city resources that New York City has put together, including nyc.gov/getfood. That's nyc.gov/getfood. These are resources that there's a food map that talks about various locations you can pick up food, which includes the Department of Education's over 400 locations where any person, you do not have to be a student, can actually pick up food for people with disabilities. There is a food delivery assistance program that you can subscribe to if you qualify. This is specifically a program that is for people who are fall under 3 categories. First, you, for one reason or another, cannot leave your home, whether it be physical barriers or concerns of your immune system being compromised. 2, you don't have anyone who can assist you, for example, in going to pick up these food, in going to these food pickup locations, or and 3, you cannot afford delivery. You cannot afford food delivery for for services like DoorDash or Grubhub or other food service. So if you qualify for all three of these, you can apply for this program, and this can either be done online at nyc.gov/getfood. You can call 311, and you can also text 311-692. 692 spells out NYC, if it helps you remember. So it's calling 311, texting 311-692, or visiting nyc.gov/getfood. Those are some food resources that we have on our website. In addition, we also have information on home health care providers. So for individuals who are concerned about losing care, or for one reason or another have lost their care and need to find someone new, we have resources on that. We also have mental health resources, because this is a difficult time. It's certainly a stressful time, certainly a time that a lot of conversation that's taking place is around coronavirus, and having someone to talk to can make a world of difference. So there's services like NYC Well, which is the city's free 24/7 confidential counseling service. We also have a number of deaf-specific counseling services where folks can receive counseling in American Sign Language virtually. So those are just a few of the many resources that we have on our site. This is something that we regularly update to ensure that we are serving as a place where people with disabilities can go, that is reactive to the conversations that are happening. And once again, that's nyc.gov/disability-coronavirus. Walei, do you want to talk a little bit about the site itself, the accessibility of it, as well as the
Yep.
I'll let you take over.
Well, as always, we wanted to ensure that our information about accessibility is accessible to people with disabilities. So we are using our, sorry, I kept hearing the screen reader in my ear. So the website is accessible. It uses accordions for each of the sections. So food and mental health. You just kind of expand each accordion, and it works with keyboards. It works with screen readers. And on top of that, and when we found, as we explore this new sort of situation more, we realized that we need to build out even more resources for people to have accessible virtual meetings. So we did create a guide on how to make your virtual meetings accessible, and that is on our digital accessibility resources page, which is nyc.gov/digital access. One more time, nyc.gov/digital access. And back to John. You can also actually just download our other guides there. You can see our digital accessibility report. Our other guides include a documents accessibility guide, a slides accessibility guide, as well as a social media accessibility guide.
I'm trying to keep an even pace of when one of us says a link, the other one puts it in the chat, because I know we're sharing a lot of information. Let me see here. So please hold on 1 second. Okay, so I just shared the digital accessibility guide, or the guides rather, and underneath is the accessible virtual meetings guide. Walei, you spoke on that already?
Absolutely, yep.
Okay, great,
And
thank you.
once again, everything you can find our digital accessibility resources through nyc.gov/digital access.
Mm-hmm. But we haven't, so this is John, but we haven't just been, sharing resources and updating websites and that's it. An additional issue that we constantly were hearing within the disability community is lack of access to PPEs, which I'm sure no one on the chat is a stranger to PPEs at this point, and the need for them across various communities. PPEs is an acronym. It stands for personal protective equipment. These are masks, these are gloves, these are face shields. And at the beginning of COVID, especially within the first few weeks where the mayors started putting in social distancing practices, there was a very large demand for masks, for gloves, and specifically going to our our first responders, the hardworking doctors and nurses and physician assistants in hospitals that are treating people with COVID. Of course, they need these resources. But what we were also hearing is that another group of people that certainly need these resources are people with disabilities, specifically the home healthcare providers that work with them. These are individuals that are in and out of an individual's home to work with them at various levels and help them being independent. Some require, nurses or to provide more intravenous medical treatment, whereas others are, still assisting, but in other ways. But regardless, there was a concern that these individuals needed PPEs, or else they might not be continuing to work in their job. So what we were able to do is, fortunately, we worked with some city agency partners, and we were able to actually get a collection of masks, non-medical grade masks. We couldn't get N95s, but non-medical grade masks that still made a difference, and gloves, and distributed them across the city to our partners, to independent living centers, to other either day have facilities or residential programs based on who reached out to us. And we're still trying to do that at the moment. We have distributed nearly 100,000 masks and gloves to combine, so about 50,000 of each across the city. And we're still working to do this. We're still trying the best we can to connect people, either directly through the work that we do, going to individuals' homes or going to these programs to provide, or by connecting them with individuals that can. So that's a little bit more information on PPEs. But the conversation continues. This is something that we're still here. We're still meeting every single week. We're still updating our resources and trying to help out in all the ways that we can. But an interesting conversation that has come up is, what does the future look like in terms of post-COVID? Specifically, when I say what does the future look like, I mean this opportunity, or this real cultural awakening to the fact that virtual meetings can exist, can have a very positive impact for people with disabilities in various ways. So, for example, let's talk about employment, right? For people with disabilities, a reasonable accommodation, depending on your disability, might be working from home or might be working remotely. And we have an employment program. It's called NYC at Work. It's a public-private partnership where we connect people with disabilities to jobs, to our various businesses that we work with that are interested in hiring people with disabilities. And as we negotiate, as we work with individuals, as we work with businesses, we would find barriers in terms of working from home. A lot of HR departments, for whatever reason, were not comfortable with individuals working remotely, working from home. But now it seems that that's what everybody's doing. Now with this change of pace, as society, as we've all needed to stay home, as we need to adhere to social distancing, working from home is no longer this far-fetched thing. We're all doing it. So we hope that, in future conversations post-COVID, we can continue to advocate for this level of accommodation, but not only in the workplace, but in other ways as well. For education, for example, having distance learning, having individuals with disabilities or folks who might not travel as well to be able to learn remotely if that's something that they require, but also from a recreational standpoint. And Walei has been working a fair amount in that department. Walei, do you want to talk about that?
Sorry, I was. Can you respond in the chat? I don't know if I was able to respond.
Sure,
but
sure.
Okay. And you were talking about the activities, right?
Yes.
Okay. So we also realize that folks need to be able to do things from home that are accessible. So we're currently putting together a at-home activities guide, accessible things to do, that includes things like live virtual meetings, whether they are tech lessons from the Andrew High Scale Library or exercising in tandem, but also live virtual verbal description tours at museums like the Whitney, the Guggenheim, and other museums, as well as recorded things that you can do on your own time, anytime. Same kind of deal of verbal description tours at museums, even some podcasts that have recorded audio dramatizations and theater performances, as well as audio, accessible audio workouts, well, actually video or audio workouts for folks who are blind or for folks who have limited mobility. So stay tuned for that. We'll hopefully be putting that out very soon.
Great, thank you, Walei. Technology provides us a unique opportunity to have conversations like this. Walei's sitting in his living room. I'm sitting in my bedroom. You're all, I'm sure, in the comfort of your own homes. And that's a great thing. And through technology, hopefully we can use this and maybe take this momentum to continue to expand access to information, to employment, to recreation, to everything. And we hope that we can really capitalize on that as we move forward. But beyond the silver lining of what have been happening, the question becomes, where do we go from here? What recovery efforts should be taking place for people with disabilities? And in the same way as we think about the resources that are available, how can we make them accessible to people with disabilities? How can we be cognizant of their needs? And that's the conversation we've started having with our advocates as well. Actually, just today, we closed this survey that we've been putting out with our partners that asks people, that solicits this feedback, that talks about, from a COVID standpoint, what has been working? What are the resources that you think were successful? And of those, what needs to continue? As we are thinking about COVID response, as we're thinking about where do we go from here, and resources that people with disabilities are going to need access to, what does that look like? What does accessible, inclusive recovery look like? So we actually received nearly 200 responses, and we are working our way through those answers. But we really want to stay engaged. We want to have a constant dialogue with the disability community. So as we continue to move through COVID response and after COVID, as we continue on, doing everything that we are going to continue doing, how can we, take this opportunity to ensure people with disabilities are represented? And with that, unless Walei, you have anything else you want to add, that's pretty much our presentation. So
Yep,
we'd be
just
happy
the
to.
one.
Oh yeah, go ahead.
The last thing is ADA 30. We're planning a slew of events for you guys or the disability community in the summer. Given that we don't know whether quarantine, will be over in July or not, we have decided to just go ahead and make everything virtual. So to celebrate the 30th anniversary of the Americans with Disabilities Act, we'll be putting on a whole bunch of events with community partners, including, performances, music, advocacy workshops, employment workshops, digital accessibility workshops, and anything else that I haven't thought of?
No, I mean, there's going to be a lot of really cool work. We're working with RP on site. They're doing a lot of great work. Positive Exposure is doing a fantastic job, and a lot of organizations who are, want to celebrate disability pride and want to really make ADA 30 this large celebration. And we look forward to continuing to work with them and amplify the work that they are doing.
So we don't have a website up for it yet, but do follow us on our website, nyc.gov/disability, or our social media, which is Twitter is at NYC Disabilities, plural. And our Facebook is what? Facebook.com/.
Nope, it's actually the same thing. Facebook.com/NYC Disabilities. But you can also look us up at New York City Mayor's Office for People with Disabilities. That is New York City Mayor's Office for People with Disabilities.
And is our Instagram pretty?
It exists. We've been using Facebook and Twitter for this information sharing period. We still have been posting to it, but that is something you can also follow us on. We will perfect our Instagram presence as we continue to move on into the 2020 year. But that is also at NYC Disabilities. But you can once again just search NYC Mayor's Office for People with Disabilities. Anything
All
else
right.
to add,
I
Will?
think that's it for us.
Okay,
We can
great.
open it up for questions.
Sure, Thomas, we're going to turn it back over to you to,
Sure.
lead us through.
Yeah, so hi everyone. I'm going to ask a couple questions that I have from the chat, but feel free to ask your own question if you want. Turn on your camera, unmute yourself, and you can ask it, or you can type into the chat. But one of the questions we had during the presentation was from Carmen. I think just to emphasize again, how do we, what's the contact for the free mask and gloves for in
So
New York City?
we're currently standardizing that process. It initially started as a response to the folks that we were working with. We had sent out a survey form, and that survey form became populated. We didn't want to overextend ourselves. So at the moment, I will say, hold on one second. I'm going to share a contact form that's in our website that you can use to direct PPE
As well
requests.
as you can, as well as you can call us at 212-788-2830. I was about to give my number. 2830. Or get in touch with us through 311. Like I said, or like John said, you can use our contact form to get in touch with us that way.
Correct. I'm still muted. Okay. So I'm putting this in the chat right now. It's the MOPD COVID feedback form. The link I'm putting is a pretty long link, but this is available on our website at nyc.gov/disability-coronavirus. At the very top, we just do like a little introductory paragraph and explain these are the ways you can get in contact with us, and then one of them is the form. I just shared the direct link to the form in the site, but for now, direct all questions, all comments really that you don't get to ask during this chat there, but that also includes, PPE requests, and we'll do the best we can to provide or connect you with someone who can. We're still ramping up our efforts, but we will. Thomas, next question through this chat.
Okay. Yeah, so the next one we have, what was the counseling service website again? So I guess just a request for the resource to the...
Sure. Let me provide an anchor link. Give me 1 second. So we have mental health resources on our site. We cited a few of them. One of them is NYC Well. NYC Well is free 24/7 confidential counseling service for any New Yorker, specifically individuals within the 5 boroughs. So first, I'm sharing, this is an anchor link to the mental health resources on our COVID site. So if you click that, that'll go straight down. But for those of you joining us on YouTube, if you visit nyc.gov/disability-coronavirus, you'll see a few accordion links, food and resources, etc. Toward the bottom, mental health resources. If you expand that, you will receive information on NYC Well, which is the free 24/7 confidential counseling service, as well as, what else do we have there?
Do you know the phone number off the top of your hand?
I do, because I'm looking at it. It is 1-888-692-9355. I'm going to type this out. Free 24/7 confidential counseling service. So it's 1-888-692-9355. Once again,
that stands for NYC Well. So
it does. I was gonna. Yep.
NYC Well. Sorry.
No, that's okay. I was gonna get there. Yeah, that was my reveal. So 1-888-692-8355 or 1-888-NYC Well. You can also text Well to 65173. And you can also chat online at nyc.gov/NYC Well. Some additional resources. Once again, I shared the link, so I'm not going to go through all of these because we'll be here for a while, and I've shared the link to where you can see them. We have the Lighthouse Guild's Behavioral Healthcare Program. So this is a telehealth program that is available through telephone and video calling. This is especially for folks, but not exclusively, for individuals who are at risk of vision loss, but it's not exclusively for folks who are blind or low vision. This is a healthcare service that can assist anyone. We have Lexington Center for Mental Health Services. These are for individuals who somebody who is deaf or hard of hearing, prefer counseling in ASL, that is available. We have a few, and yeah, we have a lot of guides as well. At the very bottom of the mental health site section of our website, we have some PDFs, some documents from USA Mental Health First Aid, how to care for yourself while practicing physical distancing. How do I know someone is experiencing anxiety or depression? How to help someone with anxiety or depression during COVID-19, and how to support a loved one going through a tough time during COVID-19. So these hands-on resources and guidance materials are all available on our website under mental health resources. You can visit nyc.gov/disability-coronavirus. Sorry, nyc.gov/disability-coronavirus. Okay.
Okay, so I had a question on the deaf town hall that you mentioned. I was
Sure.
curious if there's any best practices or even just how you set up like an ASL interpreter in a meeting like this, or how that works, or if there's any lessons learned from that.
Sure. Walei, do you want to talk about do we want to go through the virtual meeting guide more extensively, or do you want me to take this? I feel like I have a good start. Let me start, and then you fill in.
Okay.
So, let's talk first from an accessibility perspective. In a web conference, if you are just going to have an accessible meeting, first make sure your web platform is accessible. Walei, do you want to talk a little bit about the platforms or the various platforms that you think?
Yeah, I mean, I think we're familiar with Zoom. Zoom is pretty accessible. Google Hangouts Meet has accessibility and supports captions. Teams, we were talking about in the beginning of the meeting, so I'm not going to mention anything about that. Unfortunately, the city has a tendency to use WebEx, which I'm not a big fan of, but just make sure that you're using an accessible platform. If you are stuck to using something like WebEx, be sure to provide alternatives such as a phone number to dial in for folks maybe who might have trouble accessing that platform with a screen reader.
And then from that, once you pick your platform, of course, you need to advertise this meeting. So in that case, you need to, much like you would in a physical space, make sure that your meeting is having your advertisement includes information on accessibility. Will there be an ASL interpreter? Will there be live captioning? Will there be audio description? And if there's none of these things as a starting line, at least have a point of contact and a deadline for someone to request these. So Walei is holding a Zoom meeting and it's happening next week, but I know I can contact him if I need ASL, if I need captioning. And we advise that you include two, of course, because everyone has their preferences based on either disability or otherwise, 2 points of communication, a phone number and an email address, because someone might have more comfort with one over another. And I said this, but just expressing a deadline. Make sure there's a deadline for someone to request accommodations, because it's going to be very difficult to secure a captioner or an ASL interpreter the day before an event or the morning of an event. Now, you got your captioner, you got your ASL interpreter. That's great. When it comes to captioning, I would say that it's good to get a general sense of how captioning should interface with your program. But when you are having this conversation, when you are procuring your captioner, have that conversation then. I'm having a Zoom meeting. Are you comfortable captioning Zoom? Great. What do you need from me? How can we make this a success? How much time should we meet up beforehand? Because the more technology involved, the more time you're going to want to make for yourself to ensure that you can troubleshoot the issues. So then, have that captioning available. That's good. And then American Sign Language, which is a lot less complicated, I would say. For somebody who is using American Sign Language, if it's a video call, just forward them the information. And then they can join the video call, same as you. But you might want to, or it's recommended that you provide some additional insight to users who might require ASL. For example, the ASL interpreter isn't going to be speaking, they're going to be signing. And because of that, they might not be highlighted the whole time. So instructions for how to view ASL exclusively, how to pin somebody, an ASL interpreter, to the top of the screen so they never get lost in the shuffle of various people chiming in. And finally, access checks. All of these things are great, but when there's 30 people joined in a call, it can be difficult to isolate the ASL interpreter or a captioner. So just make sure that you call attention to these things, and you might need to provide additional instruction on how to access each of them.
Cool, thank you. All right, so another question came in. Can you comment on the potential healthcare rationing in New York City or in general for people with disabilities due to the ongoing pandemic, people having their backup respirators requested, et cetera?
Sure. So that is it's a very real fear. This is a conversation that we have had, that, a person during a global pandemic, that a person with a disability or a medical professional would ration healthcare away from a person with disability to somebody that is, seemingly without disability. Thankfully, we have not heard specific instances within New York City. I will say a few things. First, the Office of Civil Rights at the U.S. Department of Health and Human Services has recently issued a bulletin that reaffirms civil rights protections and provisions of healthcare services related to COVID-19. This was right when this started. This was something that was immediately put out to say that, this is not right. You cannot do this. People with disabilities, they have these protections. Secondly, this is actually last week. The Assistant Attorney General for Civil Rights, Eric S. Dryband, came out last week and said discrimination based on race, sex, religion, national origin, disability, and other protected classes continues to be unlawful during this public health emergency. So when we look up to these, to these lawmakers, to these civil rights individuals, there is a resounding, this is unlawful, this is against civil rights, you cannot do this. But, fears are still fears. We've been in contact with New York City human rights as well as state human rights. They've actually both been on our weekly call. And we're encouraging folks that if you do experience some form of discrimination, to reach out to human rights, to reach out to city human rights, reach out to state human rights, etc. And I can share that information. I don't have that off the top of my head, but basically it's something we're aware of at the moment. Civil rights folks are saying a lot to say that that's just unconstitutional, that is unlawful, and we are very thankful for that. And of course, I mean, I duh, I guess is my next thing to say. But reach out if you do, as an action item, if you do experience discrimination, or somebody, friend or family member experiences discrimination, reach out to human rights, state office, local office, reach out to our office. And we'll go from there.
Awesome, thank you. Okay, a question from Aurelia Care. Can you please explain what the problem is with WebEx so I can explain that to my job? So I think for the
floor is yours.
How much time do we have? No, from my own experience with it as a blind person using a screen reader, it's a very confusing platform to navigate. When I try to join the link, it takes me to a page. There's a join link on that page. I guess it pops up with a modal that is not accessible. There's just a whole bunch of issues. It's mainly for me as a screen reader user. I have trouble using it and navigating it when compared to platforms like Zoom, which just work.
All right, anyone else have any questions? You can either join in with your video and chat here directly, or type into the chat.
By caregivers, do you mean personal care attendants and those kind of folks who serve in that way? John, you want to take that one, or should I take it first?
Sure.
Okay.
So one thing that's been happening, as I mentioned before, is that due to lack of PPE, there's a concern in certain cases. Folks are concerned for their own health and not showing up to work. We have been trying to New York City has been trying to, connect these individuals, these service providers with masks and gloves to address this. That's the first thing, but beyond that, I'm not sure of other barriers that have been arising. Walei? But I'll say that we are constantly within conversation and opening our lines to anybody who is experiencing issues with home healthcare providers, with home health aides. Um, if
Sorry about
you
that.
if you
Okay.
are some need
Oh,
of home health care, and for one reason or another you're unable to receive service, please reach out to our office. You can call us at 212-788-2830. That's 212-788-2830. You can visit our website, nyc.gov/disability-coronavirus, for additional home healthcare services. And you can also, connect with us via video phone if you are a person who is deaf and prefers to communicate in ASL at 646-396-5830. Thank you.
sorry. Can you hear me? I had trouble unmuting before.
Yeah, no, I heard you.
Okay, cool.
Wale, this is another question from the chat. Question from a friend. Could you comment on ongoing difficulties for those who are low vision and blind when applying for unemployment, specifically for those who don't use computers?
Sure. We have had a lot of complaints about the Department of Labor, the State Department of Labor, and getting through to them on the phones. We don't necessarily have any quick fixes for that. Unfortunately, we are not like part of the state government. So what we recommend is maybe if you are having issues getting through, to reach out to any entities that you can complain about them. So maybe the State Division on Human Rights could be helpful in that sense. Like I said, as a city entity, we don't have any sort of sway with the state government.
I will say that there is one financial resource that we can talk about. It's separate from unemployment, but just while we're on this topic, our office has been working with the Department of Consumer and Worker Protection to roll out a program. We've had it for about a year now. It's called Empowered NYC. Empowered NYC is free financial counseling for people with disabilities in New York City. So this is a program that, due to COVID, has moved online. The services have moved online, no longer in-person meetings, but you can visit nyc.gov/empowerednyc. That's nyc.gov/empowerednyc. And this is a service that can assist you in, planning financially for your future and, making a budget and other things like that. Let's see. I'm just looking for a phone number as well. I believe you should be able to just either call 311 and ask about Empowered NYC, or text 311-692. That's, text 311-692 to ask about Empowered NYC. I'm looking for a specific number and I'm having trouble finding it. But that is that. In addition, and once again, this is not unemployment, as well. I said that's through the State Department of Labor, but additional financial resources that you can look into are through Access HRA. As a result of COVID, once again, they have moved a lot of the services that traditionally you might need to apply for in person, cash assistance, supplemental nutrition assistance program. You can apply for all of those now online at nyc.gov/accesshra. That's nyc.gov/accesshra. I'm just testing that to make sure. And yes, I'm right. So I'm going to share that in the chat. So those are some additional resources.
Also, I want to put it out there, it's not just people who are blind or have low vision that have had trouble getting in touch with the Department of Labor. Any folks that try to call in have had that issue, so it might be worth connecting with other communities that are having this issue to advocate together.
Okay, great. Well, I want to say thank you to both of you for the excellent presentation today. I wanted to let you know that we had at least one tweet come in while we were in that they were joining from India and commenting on, wow, we don't have anything, like this from our government institution for what's being done. So it's really cool that hopefully all these links can help be a model too for other governments to look at what you all have been doing. So again, thank you for a great presentation today. And thank you everyone for joining our first virtual Accessibility New York City meetup. Thanks again to our sponsors, Adobe, Level Access, and Equal Entry. Thanks everyone for the nice comments in the chat. And I would say for us ongoing, one thing we'll be interested in your feedback for this meetup in the future is if you want us to bring in people that aren't New York City based. I mean, one of the things that's interesting about Meetup is that typically it requires being local to New York City. But I guess in this time of COVID, now we have the whole world opened up. But we would be interested in your feedback of if you would like us to continue featuring New York City based presenters as we have to keep this meetup virtually for the time being. So let us know that. Thanks everyone again for being in our first event. We're going to leave the Zoom open for a little bit longer if anyone wants to chat in here and try and have some socialization like we would normally have at the end of our meetup. So if anyone just wants to talk or connect, you can do that via the chat or just staying in the meeting. And again, thanks John and Walei for a great presentation tonight.
Thank you very much for having us.
Yeah.
Thanks, Thomas.